Now, I would like to introduce the man of the hour. No. Sorry, I don't have a lay for you, Harold. This is Harold Brackeen. He is the administrator of the Homeless Programs Office, and he's got a presentation too. Thank you.
Well, thank you, John, and thank you all for your interest in the Department of Human Services Homeless Programs Office funding opportunities. I'm Harold Brackeen, Homeless Programs Administrator, and with me today I have Program Specialist Didi Kamunkon and Judy Ishida. We will provide guidance with procurement to those interested in various programs administered by HPO. In addition to today's presentation, additional information can be found on the state SPO website, like John mentioned a few times. First, I'd like to highlight some examples of 103D. Actually, I'm gonna hold off on this for a little bit. I wanted to highlight and give some real examples of 103D and 103F contracts so that we're all on the same page. And so, for goods and services, 103D contracts, examples include, out of HPO, would be for consultants, training, reports, and data analysis are some examples. And for Health and Human Services 103F, contract examples include contracting with service providers for financial assistance and intensive case management services, street outreach, homeless shelters, and permanent supportive housing programs. So those are some examples of the two. Today's topics, I'll cover organizational overview, Homeless Programs Office overview, goals and population served, request for information, and request for proposals. Organizational overview. So Homeless Programs Office is a part of the Department of Human Services. And I have a couple of charts that'll help this morning. And so the first one quickly gives a quick organizational chart of the Department of Human Services. So there in blue at the top is the Office of Director, responsible for Office of Youth Services, Commission on Women, Commission on the Status of Women, HPHA, Commission on Fatherhood. So those are those sister agencies or brother agencies related to DHS. And then we have what's in a lighter shade of blue, Benefits Employment Support Services Division, Division of Vocational Rehabilitation, MedQuest Division, and Social Services Division. And in BESD, or Benefit Employment Support Services Division, the lighter blue on the bottom, we're one of, as you can see, many program offices, a part of BESD. So Homeless Programs Office is there. In the Homeless Programs Office, we have an administrator, secretary, office assistant, a homeless program specialist 5, which would be equivalent to like a state planner or a deputy in a state office. And then we have several homeless program specialists. All are assigned various programs, whether they're federal or state. So HPO overview, I want to cover our purpose, goals, and the continuum of care. HPO's purpose. HPO administers an array of services designed to address homelessness statewide. HPO develops, implements, and manages a variety of state and federal programs. So developing programs and contracting with nonprofit organizations to deliver homeless services. We also work with state, federal, local governments, and each COC, there's 2 in the state of Hawaii, Partners in Care on Oahu, and Bridging the Gap for the neighbor islands. And we coordinate efforts, resources, and effectively provide services for homeless individuals and families. HPO's programs, so homeless outreach services providing comprehensive coverage statewide. Emergency and transitional homeless shelters, which provide a secure and stable environment for people experiencing homelessness, allowing them to take the first step towards obtaining permanent housing. Financial assistance and housing-focused case management services, such as the State Homeless Emergency Grants, or SHEG, Housing Placement Program, or HPP, and Rapid Rehousing Programs. Housing First programs, which provides permanent housing and clinical services to address a variety of disabling conditions, such as addiction and mental illness. And finally, federal programs include the Department of Housing and Urban Development's Emergency Solution Grants, or ESG, and the Housing Opportunity for Persons with AIDS, also known as HAPWA, on behalf of BTG. HPO's goals is to prevent or divert homelessness, reduce the length of homelessness, obtain and maintain permanent housing, and reduce returns to homelessness. So prevention means housing, relocation, or stabilization services and short and or medium-term rental assistance as necessary to prevent individual or family from moving to an emergency shelter. Diversion, a strategy that prevents homelessness for people seeking shelter by helping them identify immediate alternate housing arrangements, and if necessary, connecting them with services and financial assistance to help them return to permanent housing. We want to make sure that we reduce the length of homelessness, making sure that homelessness is brief and non-recurring. To obtain permanent housing is one thing, but more importantly, we need to maintain permanent housing. And we do this by helping to build social capital, which is a positive network of social connections and resources available to individuals and families. These connections and resources can have a positive impact to break the cycle of intergenerational poverty, ultimately supporting and securing permanent housing. Continuum of Care. So COCs are the U.S. Department of Housing and Urban Development bodies to carry out responsibilities defined under 24 CFR Parts 578, authorized by the HEARTH Act. Each COC is responsible for coordinating funding policies, strategies, and activities toward ending homelessness in a designated geographic region, including but not limited to plans and oversight for the use of HUD COC funding. So again, in Hawaii, we have 2 COCs, Partners in Care for Oahu, and Bridging the Gap for the neighbor islands. Federal programs that HPO has been a part of is ESG and HAPWA. We're currently administering for BTG. And we previously, I think it's been a year now, that we transitioned the COC programs on the neighbor islands to be direct grantees of HUD. But that would fall under the COC programs, formerly known as the Shelter Plus Care Program. So Continuum of Care. Here are some examples. The COC is comprised of private, state contracts, volunteers, city contracts, on the neighbor islands, county contracts, federal contracts, other, and of course the faith-based community. So collectively, they make up and they are the Continuum of Care. And so now with all this background information, it helps us to move forward as we take a look at the procurement process. Let's start with the RFI. So as John spoke, RFI is the request for information. Are you interested in making a difference in homelessness in your community? Here's how. HPO procurement process. So if we take a look at this guide here, we start with an RFI, which leads us to an RFP. So we get all the information from the community within state government, working with our legislators. And then that helps us to design an RFP, a request for proposals. The request for proposals has 5 sections. Section 2 is the service specifications, which really outlines what we're looking for and what we want providers to submit their proposals to provide, leading to a contract start date and service delivery. And then the contract ends, not just each year, but for the life of an RFP. Sometimes it's 2, 3, 4, 5, even up to 6 years. When that RFP ends, the contract ends, then we start basically, if funding continues, we will start the process all over. We'll go out for another RFI to see what we've learned, what feedback we can get from the community so we can improve the services and continue to evolve, continue with best practices, continue to improve on the work in the community. Next slide, we have an example of an RFI. So the RFI is a notification to the public that the Homeless Programs Office will be seeking feedback pursuant to Section 104, Public Law 104 to 193. The RFI provides a brief description of the services and submittal instructions. The RFI is issued through state procurement website and posted for a minimum of 7 days. So just like in John's example, if your organizations are looking to participate in this process and you check the SPO website every 2 weeks, you could lose an opportunity to provide information to the state. The information and recommendations received through an RFI assists HPO in preparing a request for proposals. Request for proposal. It could take weeks to months to finalize an RFP, and post it on the SPO website. So please check the SPO website daily. Request for proposal, RFP. The RFP is a primary tool for developing a successful proposal. In general, it's posted on the SPO website for a minimum of 30 days. Along with submitting a complete and thorough proposal based on the RFP prerequisites, applicants may incorporate their own unique perspective that complements the core program. All laws, statutes, and basic requirements referenced in the RFP shall be met. HPO allows for questions to be submitted in writing for clarification, and all responses to those questions will be posted in an addendum to the RFP on the SPO website. Addenda are used to correct, revise, and respond to questions from all interested applicants. It's just as John has shared, it levels the playing field. Everyone has the same information. All interested applicants are strongly encouraged to participate in the RFP orientation. When mandatory, participation is required to submit a proposal. The RFP is organized into 5 sections. So Section 1 is the administrative overview. Section 2 is service specifications. 3, proposal application instructions. 4, proposal evaluation. And Section 5 is attachments. So we'll briefly take a look at each of these sections. Section 1, administrative overview, provides an administrative details to all interested applicants, included a procurement table which lists activities and corresponding dates of the RFP. And here's an example of that timeline. So Section 1, procurement timetable. All the major activities is listed, as well as the dates that those activities will be completed on or by. Section 2, service specifications. This is the heart and soul of any RFP. This section describes service goals, target population to be served by this funding opportunity, geographic coverage of service, probable funding amounts of contracts to be awarded, source of funding, contract term conditions, scope of work, approaches and strategies, training requirements, compensation and method of payments. So let's take a look at an actual list of items that makes up Section 2, service specifications. So in the RFP, each one of the sections is outlined using one of these topics. We start off with definitions to make sure that everyone understands what definition of homelessness the funding is, the funding opportunity is tied to. We provide an introduction, an overview, purpose and need, planning activities, description of service goals, geographic coverage of service, funding, all the forms, as John mentioned, we're state, we're government, we really love our forms. Helps to provide consistency. So we also are moving towards standardized homeless verification letters. We provide information on contract monitoring and evaluation, general requirements, secondary purchase information, and so forth. And we don't even get to the scope of work until the bottom of the list. So there's a lot of detailed information, a lot of requirements, a lot of things that's provided in the RFP that the expectation is the provider, the provider is to meet those expectations. So as I mentioned, homeless definition. So here, section 2 opens with definition of terms to ensure a consistent understanding of the common terminology used in homeless programs contracts. Special attention should be paid to the criteria for defining homeless and chronic homeless. So here, we had homeless, and now we have chronic homeless definition. So chronic homeless, an individual or family that is homeless and lives or resides in a place not meant for human habitation, and for at least 1 year, or on at least 4 separate occasions in the last 3 years, where those occasions cumulatively total at least 12 months, and has an adult head of household with a diagnosed disorder, mental illness, or disability. HPO does allow for an exemption request once contracted and working with the community and to address homelessness. HPO has an exemption request for chronicity. So if the individual does not meet the 12 months in length of the 3 episodes of homelessness, or 4 episodes of homelessness, then there's more forms that can be submitted to our office to consider providing services to that household. Scope of work. So here, item 2.5 of section 2, service specifications, describes the scope of work for the specific program contracted. There are 2 parts to this section. We have service activities and admin management requirements. Very important to read the details, read the RFP, align your proposal with the RFP, making sure that you'll be providing the services that HPO is asking. Service activities. The service activities section describes the housing first approach. All state DHS HPO programs are required to utilize this approach. This slide has examples of housing first program as an approach, not a program, but as an approach. This is not for permanent supportive housing. This is for all of our services, all of our core services. Besides the housing first approach, our RFP also describes other approaches such as assertive engagement and harm reduction. HPO also requests information in areas such as supervision of staff to support their needs, as well as grievance procedures to clients to be treated fairly. So highlights and examples of the housing first approach. I won't read all of this, but just to highlight some: removing barriers to program entry, not establishing arbitrary time limits on length of program participation, assist quickly in locating housing, gain documents, assisting to access income through public benefits and/or employment, and so forth. There's a few others here. So these are key highlights to the housing first approach in all of our HPO contracts. Administrative management requirements. So part B of the scope of work includes requirements to be demonstrated by the applicant in the proposal. This slide highlights some examples of some of these requirements. So the first one, verifiable experience in the program area for which the proposal is being made, 1 year within the most recent 3 years of experience with the program area for which the proposal is being made. So again, 1 year within the most 3 years of recent experience. Capability to coordinate services and resources with other agencies, participation in the local COC, adequate staffing levels and qualifications, organizational charts and staff to client ratios. And the last one I'd like to highlight is training plans, making sure we have good, robust training plans to support our staff and each other doing the work. Next, if we take a look at contract performance criteria, service delivery, so performance measures and outcomes, input and output measures, quality of care. So for quality of care and quality of services, we look at activity reports, monitoring, and corrective action plans. For financial management, it's the same. So our program specialists look at financial reports, monitoring, and corrective action plans. So Section 2 also addresses the criteria by which performance of the contract will be monitored and evaluated. Specific criteria may vary depending on program being solicited. This section describes in detail the specific qualifications and general requirements of the provider, including but not limited to licensure and accreditation as well. Section 3 of the RFP. This is for proposal application instructions. And this is the first page of Section 3 in all of our RFPs. I know there's a lot there and difficult to see. But what we have here is some examples. Some examples I can tell you just off the top of my head is what size font, what type of font, what's your margins, your spacing, all of those things. Because it's very critical when you have 30, 40, 50 proposals coming in for one service activity. And sometimes we get proposals that providers are more interested in how it looked, what type of borders, adding cartoon characters and other types of just pictures. We're not interested in those things, and it becomes very difficult for an evaluation panel to evaluate a proposal if there's all those other things happening in the proposal. So we want it just very plain, basic, so we can look at 30, 40, 50 of them and get through a short period of time. So Section 3, proposal application, describes the required format and content for the proposal application. It's the how to apply section. DHS HPO prefers that the applicant does not exceed the listed number of pages in the narrative portion of each section. And that's on the bottom of the page. This does not include the required attachments. It is important to note that the content requirements may vary depending on the specific program being procured. However, the following are examples of common proposal elements. So next we have Section 4, proposal evaluation. So you've done a good job, you've read the RFP, Section 3, service specifications, you're writing your proposal, you're using the margins, the font and font size, everything's aligned. And so now Section 4 helps you to know and understand how your proposal will be scored. So Section 4 is the proposal evaluation. Note that evaluation criteria and corresponding point values may vary depending on the specific program being procured. The evaluation will be conducted in 3 phases. Evaluation of proposal requirements, evaluation of proposal application, and recommendation for award. The evaluation committees are utilized and comprised of individuals with experience and knowledge of the program in the service being procured. So here we have the evaluation of proposal requirements. It's a real nice checklist that we have, and it's the same checklist that we provide in our RFP. So any one of those activities with a no would be what John was talking about, that it would not be accepted or not be evaluated. So this is phase 1. So do you have, as a provider providing a proposal, do you have all items on the proposal application checklist? Do you have your tax clearance certificate, your vendor compliance certificate? If those are yeses, we move forward to the next box. Proposal application requirements. Proposal application identification form, has that been provided? Yes. Table of contents, program overview, experience and capability, project organization and staffing, service delivery, financial, and other. If those are all checked yes, because we can quickly look at the proposal because they've all been tabbed as we asked in Section 3. If those are all yes, then we move forward in the evaluation. Phase 2 of the evaluation. So we look at all the narratives. The applicant's total points will be identified and categorized as one of the following: more than, meets, or less than. In this example here, a satisfactory proposal score is 70. And so in order to be considered for funding, the application needs to score above 70 or above. If the applicant is awarded the contract, the Department of Human Services Homeless Programs Office requests that any comments written on the proposal evaluation form be addressed by the applicant before contract execution. The applicant's scores in service delivery category will be utilized to break any initial ties in scoring. So if there's any ties, because this is all competitive, if we have two providers with the same score, we're going to use the service delivery category as the tiebreaker. If subsequent tie breaks are needed, the applicant's score in the category of experience and capability will be used. In phase 3, recommendation for award, each notice of award shall contain a statement of findings and decision for the award or non-award of the contract to each applicant. So this information are the award notices that go out or non-award notices. And with those notices, like I mentioned before, there's usually a list of items that needs to be completed prior to contract execution. Section 5, attachments. So Section 5 includes all actual forms or referrals to tools necessary to complete the application, including, and here's a sample list. So we have proposal application, identification form, proposal application checklist, sample proposal application, table of contents, proposal application, and I have highlighted here budget forms and instructions. General conditions, cost principles, homeless verification letter, SPDAT forms, which is different than the VI SPDAT. The VI SPDAT is the Vulnerability Index Service Prioritization Decision Assistance Tool. It's a tool, it's a triage tool. The SPDAT is a full assessment that is used. And so the local COCs have identified and they're using the VI SPDAT. In our contracts, we're requiring our providers to also now to standardize the assessment portion to use the SPDAT. Housing plan, including discharge planning, facilities description, performance measures and outcomes form, and program and fiscal reports. And the last one there that I have highlighted is work plan performance measures, because I'd like to talk a little bit more about those two highlighted areas to help. The first here is a sample budget form. So please submit a clear, detailed budget utilizing the pricing structure designated by the state purchasing agency in Section 2 of any RFP. Use the State of Hawaii cost principles as a tool and guide. The budget shall fully support the delivery of the proposed services, including the RFP service specifications and proposal narrative. The provider shall attach to the proposal its policies and procedures that are implemented to manage finances in order for DHS, Homeless Programs Office, to determine the adequacy of the provider's financial controls and accounting system. Demonstrate the capability to coordinate, integrate, and match funds to support the proposed program under any funding opportunity. Reporting requirements for program and fiscal data include, so we have quarterly financial reports, so every 3 months within 30 days of the end of each reporting period. We also have a final financial report within 45 days of the contract term. Really important for us to follow the information and instructions for the budget form. In addition to the budget requests with HPO, we also ask that a budget form be submitted such as this that splits into 85 and 15%. So 85% becomes the contracted amount, 15% becomes the amount that is attached to performance measures, and those are earned on a quarterly basis. Next, we have a sample work plan. So the work plan is really important as it projects. It provides a proposed number of adults or children or households to be served during each contract term. This also helps us with our monitoring. So it helps us to monitor those activities that I mentioned prior, such as the VI SPDAT or the SPDAT, and other tools and resources and information that we ask providers to complete and take care of. All these numbers are captured, and then the reporting that we have will let us all know how well each provider is doing, as well as areas for improvement that can be addressed in team meetings or individual supervision. This becomes a tool for the larger picture for the organization to guide the services and guide the program staff. And so the work plan does become part of the budget. The contract. The work plan becomes part of the contract. Performance measures and outcomes. So here we have the capacity of households served, total increased income, return to homelessness, percentage of households served who are exiting to permanent housing. So this here was HPO's work and intention to connect and align with federal initiatives. HUD has system performance measures that they review and they look at. And so the state of Hawaii has a lot of resources put towards homelessness. And so we want to make sure that we align with the system to maximize our resources. And so those system performance measures, we have outlined anywhere from 3 to 7 in each one of our core services that we procure for. And they all have performance measures that is attached to funding. Like I mentioned, the 15% of the contracted amount is attached to how well each provider performs. HPO also reserves the right to adjust and/or modify the performance measures and outcomes. Payments are attached to performance measures and details are included in each RFP. That's a lot. And so our next slide. So just like John had mentioned, we're here to help. And so besides the State Procurement Office, John and Christopher, there's also myself, Harold, and Dee Dee that was a part of putting this training together. And so if there's any questions that you folks may have, you're more than welcome to reach out to us. In closing, every RFP is unique in its own way, so it is very important to pay attention to the conditions and requirements of each. A successful proposal can be developed if you thoroughly read and understand each RFP component, which in turn will strengthen the possibility of obtaining an award through a variety of funding opportunities. Thank you for your attendance and participation today.